He's not a doctor, but as a physician assistant, Sahand and Safi might be the next best thing.
We could do any part of the patient interaction that a physician would typically be doing. So that could include anything like a history, a physical exam, ordering tests, interpreting those tests and making decisions based on our interpretations, prescribing medications.
Taking the strain off his supervising doctor and easing the backlog at Toronto General Hospital's emergency department.
They basically work just like a mirror image of me, meaning that they are able to see a lot of the same patients that I would have seen.
Because they're paid considerably less than doctors, physician assistants save an overburdened system precious dollars. Physician assistants are popular in the United States and in Western Europe, but here in Canada, their numbers are still relatively low. In 2013, there were 308 physician assistants across Canada. The latest numbers from 2017 show an increase, but the total is still less than 800. And in provinces like Nova Scotia, PA positions are in the military only, not at civilian hospitals. Dr. Lucas Chartier says having hundreds of PAs in Canada is not enough. He says by now there should be thousands.
Whether it's 300 or 700, it's not enough to meet the needs of the ever-growing population.
Despite having emergency departments that are routinely forced to close because of staff shortages, Nova Scotia is only now adopting physician assistants, hiring 3 PAs for a 3-year trial period.
Having a pilot project for a very small number of PAs. This is a kind of a half measure, a very kind of tentative, tepid approach.
So why dip a baby toe in the ocean when they could have dived in years ago?
Where the roadblocks have been, I guess, has been in the funding of the positions for starters. We really do know and think that they will add value, and we do think they will help with the productivity in the system as well.
Making slow progress on an urgent issue. Ross Lord, Global News, Halifax.
To become a physician assistant, students need an undergraduate degree in science or health sciences. That's followed by a 2-year training program. Currently, the program is only offered at 3 schools: the University of Toronto, McMaster University, and the University of Manitoba. After graduation, students can expect to earn an annual salary between $75,000 and $120,000.